Hey, to all my ladies out there, are you having significant pain with sex or just struggling to have intercourse in general? Perhaps you're having pain or discomfort right on entry and it feels like a burning, a stinging, or just a sharp pain. Or perhaps you can get past the entryway, but it's like a deeper ache that feels like it penetrates in other areas, like in the lower abdomen or in the ovaries, or perhaps it feels like something's hitting around the cervix. Perhaps it's the inability of your partner to penetrate. Maybe it feels like there's a wall or a block or something's getting stuck, and maybe it's associated with pain, maybe not. Or perhaps you're also having other symptoms that are accompanying this, and you may not have made the relationship to this difficulty with having sex. But I'm here to tell you that this is a legitimate issue, and it is a physical issue. And do not let anyone tell you that it's just in your head, because it's not. I'm Hina, pelvic floor therapist, and I have been helping women overcome issues with sexual intercourse and penetration for over 25 years. I know that this condition can cause a lot of anxiety and frustration and sometimes even depression in so many women that are experiencing and going through this. I'm sure you're feeling like, why is it that I am not normal? Why is it that my friends can engage and have amazing sex and I can't? And I'm here to tell you, I know how you are feeling. And the reason why is because I talk with women every day that are going through this same issue. And I want you to know that you are not alone. In fact, 30% of women worldwide end up having issues with intercourse. And even according to one of the prominent organizations, ACOG, otherwise known as the American College of Obstetrics and Gynecologists, they sometimes report that up to 75% of women at some point in their lifetime will end up having problems with intercourse. So again, I want you to know you are not alone. Oftentimes, I hear so many times that women end up going to their gynecologist or a healthcare provider to have a checkup, and they actually tell them that they're having a problem with intercourse. And sometimes they're disregarded. They've been told it's in their head. They just need to relax a little bit, or perhaps have a glass of wine before engaging in intercourse. And I get it. That's frustrating because that is not always going to solve the problem. And it's in fact not the solution. And so I'm here to tell you that this, for many, many women, is actually a physical issue. So I am going to get into the reasons why. But before we start, I need to talk to you a little bit more about the anatomy so that all of this makes sense. This is a model of the pelvis, and your pelvis is made up of 3 bones. You have your 2 bones here, which are called your ilium. They kind of look like elephant ears. You have your pubic bone in the front, where these 2 elephant ear bones come together and form what's called the pubic symphysis. And then you have a bone in the back, which it kind of looks like a cobra head. It's called your sacrum. And these 3 bones make up the pelvis. And the top part of that pelvis actually has part of the lower part of your spine. And the lowest part of your pelvis actually has your tailbone. And so these 3 bones create almost like a circular bowl that then holds a bunch of organs and muscles deep down inside. Now, when you go see your gynecologist and they're doing an exam, the biggest things that they're looking at is they want to see, first of all, does everything look okay from the outside? So they're going to check what's called the labia or the lips of the vaginal opening. They're also going to check what the tissue quality looks like. And then they're going to do an internal exam of the organs in your pelvis, mainly like your ovaries, your uterus. They're going to check your cervix, and they're also going to do a swab test to make sure that you don't have any sort of pathology, whether it's anything that's related to cancerous cells, which is a pap smear. They're also going to look to see, are you having any symptoms that might be something more infectious related? So that is what a gynecologist's job is. It's to make sure any of the big medical issues are being addressed and that there's nothing there going on. So oftentimes you might hear a gynecologist say, hey, I know you're having pain with intercourse, but everything looks fine as far as your organs are concerned and as far as what we see from a tissue standpoint. However, many gynecologists don't realize that there is a whole nother system of muscles that are inside of this pelvis that actually can cause significant pain or a block with intercourse. And so there are amazing gynecologists out there that understand that these muscles are an issue. And oftentimes they'll tell you what the issue is, but they may not tell you what to do about it. And then unfortunately, there are many gynecologists that don't even even realize that there is a muscle system in here. And this is what we are going to talk about first. There is a group of muscles in here called your pelvic floor that are comprised of 14 muscles that line the inside of your pelvis, and they have 3 layers that then extend all the way to the outside of your pelvis, surrounding the vagina, surrounding the urethra, which is what you pee out of, and surrounding the rectum, which is what you poop out of or you defecate out of or have a bowel movement. And so if there is problems in any of this musculature, they can affect any and all of these areas. Now, let's first talk about pain on entry. What could be causing that inability to penetrate because of excruciating pain or a sharp pain or a burning pain right on entry? So with this, there's kind of a couple things to think about. One is you want to make sure all the physical structures are okay, that you don't have any excessive tissue that may have not been opened up fully with time and maturity and going through all the hormonal changes and puberty. And this is where your gynecologist will typically check all of those structures and make sure they're okay. But oftentimes I have heard that certain of these things are missed because everything looks okay, but it hasn't been fully looked at. So that is number one. You want to make sure that things like the hymen are open and there's not excessive tissue that may be contributing to that. So that's something that you can ask your gynecologist to check. Now, the other piece is it could, for some women, young women, be hormonal. And when I say young women, hormonal being if you've been on birth control for a really long period of time, this can change the balance of your hormones. And for some that have a genetic predisposition, being on birth control can actually change the tissue and lead to irritation of these tissues in this area. And sometimes it's not easy to see. So gynecologists may miss that, but that could be causing it. So if you're one of these women who have been on birth control and found that, hey, it wasn't too far after that I started having some difficulty, or maybe you don't know, then this is something that you may want to consider and maybe talk with your healthcare provider. Now, the other piece is these muscles. So the first layer of muscles, which is this layer right in through here and across in here, if these muscles are tight, they can cause burning, stinging, or significant pain right on penetration because these muscles line the entry right at the bottom of your vagina. And so oftentimes people will say it hurts right here, right at the bottom when, anything penetrates in that area. And sometimes it's not even intercourse. It could just be you're trying to use a tampon and that causes pain. Again, if you're having pain on penetration, that could be a few of the causes. Now let's go to the next bigger piece, which is this block and or deep pain when you are having intercourse. Now, remember I said that these muscles are 3 layers. These layers go deep into the inside of the pelvis. And so as you're having penetration through these layers, perhaps the outermost layers are okay, but the deeper layers might be a problem. And these muscles, when they are a problem, can mimic pain that sometimes feels like ovary type pain. It feels like, do I have a cyst on my ovaries? But again, nothing's checking out from a gynecologic standpoint. Or it causes deep lower abdominal pain or almost like cramping when you're gonna have your period. So if you are experiencing that type of pain, or you are having a block, meaning that something isn't going through, then it could be this tight musculature. We're gonna talk about why that actually becomes painful in just a little bit. So the other pieces that oftentimes are associated with painful sex can also be constipation. And remember I said that these muscles line around the rectum. Well, if these muscles are all tight, or many of them are tight, remember I said there's 14, then this can also cause closure of the rectum. So oftentimes pain with intercourse can be associated with people also experiencing constipation. Because again, if these muscles are tight, it's gonna be difficult to not only have something go in, but something come out, such as having a bowel movement. So if you're experiencing constipation along with painful intercourse, this could be a key that, hey, I think my muscles might be the problem. And then the other area that can cause a problem is pain or discomfort or frequency with peeing. And what do I mean by discomfort with peeing? Well, if you feel like you're kind of prone to a urinary tract infection, but you get tested and it comes out negative, but you're like, it just feels like something's irritating and I feel like I have to go to the bathroom all the time, kind of like a UTI. Well, it could be these muscles that are causing the urethra, which is what you pee out of, to get irritative. And so again, feels like a UTI, but is actually caused by muscle. And what I mean by frequency is if you feel like you're having to go to the bathroom all the time, time, and maybe you don't even know what that means all the time. Well, typically when you urinate, you should be peeing anywhere between 12 to 15 1/1000s or 1 Mississippis. So if you are not peeing 12 to 15 seconds and you're finding yourself going to the bathroom and only peeing like 6, 7, 8 seconds, and then you have to go again an hour or two later, or maybe even 30 minutes later, then that is called frequency. And again, if they're not associating that with any type of an infection that's going on, then this could be the muscles. So again, if you're prone to that and you're having pain with sex, again, you can assume that maybe there is a muscle issue. So in this area, just like any other parts of your body, this is muscle, just like your biceps. You have to contract your biceps. You have to be able to lengthen the biceps for your arm to function. A tight muscle is no good. It doesn't have good coordination, doesn't have power. So if these muscles are really, really tight, you're also gonna kind of have what's known as a weak muscle group because they're kind of handicapped. They're not doing the things that they need to do. And so when these muscles are tight, they can actually end up being like a tight fist. If you held your fist really, really tight and you just held this for 30 seconds as tight as you can, your fist and your hand is gonna end up being pretty uncomfortable. And when it's uncomfortable, you're gonna have a lack of blood flow. And then you've got nerves also in this area, just like you do your hands. So if that is compressed and tight over a long period of time, then you're going to end up having pain. And the pain comes from these muscles being really, really tight, compressing around the nerves, not having good blood flow, and over time, you can end up developing something called trigger points. And trigger points can happen in any of these muscles in the pelvic floor. And those trigger points I want you to think of kind of like a spasm. It's a spasmed muscle that now is not functioning well and it's painful. And that muscle spasm or trigger point can end up causing pain right there where the spot is, or it can end up causing pain that actually refers into other areas. So again, if you're having any trigger points in this deeper area of the pelvic floor, they can actually send pain up into the lower abdominals. They can send pain into the groin. They can contribute to pain in the low back. They can contribute to pain in your tailbone. They can contribute to pain that feels like it's in your ovary. So again, you may be going to your healthcare provider and they're looking for stuff that's medical, but it's not actually a real medical organ issue. It's actually a muscular issue. And in this area, you also have a lot of nerves, tiny little branches that end up coming from bigger nerves that come out of your spine. And so if you have had any trauma in this area, perhaps you've had a traumatic childbirth, or you may have had an injury that may have created compression or trauma in this area. Perhaps you've been sitting for a long period of time. So those that sit in this area for long extended periods, bikers, can also experience a lot of compression in this area. Eventually, tight muscles or excessive compression or trauma or scar tissue can end up disturbing those nerves, and then those nerves become hypersensitive. This, for some women, can cause intolerance to even wearing underwear. They can have pain or discomfort with sitting, and then that eventually can end up spreading out over time to bladder issues, to also constipation and rectal pain issues, and for some, tailbone issues and even low back issues. So all of these muscles can end up causing all of that. So if you're thinking any of these are the causes of what's going on, then we got to think of a solution. So what do you do about all of this tight musculature? And how is it that you're going to get back to having pain-free intercourse? Well, it lies in actually improving the flexibility and the health of all of these muscles that might be contributing to everything that I just talked about. And so really trying to improve the flexibility, the mobility, the circulation, to take that compression off of those nerves and allow better blood flow into this area is going to help bring all the nutrients and all the oxygenation to these tissues to help repair and decrease all of that pain that you might be having. If you're not sure which one of these might be contributing to your issues, then check out our playlist where we go more in depth about other issues around pelvic health. And if you're looking for a solution, then check out our link below where we have an online program for you to be able to have pain-free sex again.